Tinnitus Awareness Week is an annual event dedicated to raising awareness about tinnitus, which is a condition characterized by the perception of ringing or other sounds in the ears without an external source.
So Dr. Kari Wickstrom joins us now to share more about tinnitus and how this week is an excellent opportunity to seek professional advice to manage this condition. Thank you so much, Dr. Kari, for being here.
Having me.
So many people have never heard of this. I know sometimes we kind of hear the ringing in our ears and you'll see them kind of gnawing like the dog, you know. Tell us a little bit more about this condition.
Yeah, so tinnitus, or you might have heard the word tinnitus as well. They're both pretty much the same thing. It's categorized as any kind of sound that you hear that's not part of your environment. So it can be, for most people, it is like a ringing in the ears, but some people hear buzzing, whooshing, roaring. Basically, it's your brain trying to fill in some gaps of what it thinks it's missing. Most of the time, tinnitus is related to hearing loss or auditory damage. So that's why a lot of people with hearing loss will have that symptom as well, because your brain is trying to give you back something that it thinks it's missing.
Now, if you have this, at what point do you say, okay, I need to go get this checked out?
So it's pretty common for the average person to get a little bit of tinnitus, like every once in a blue moon for a couple seconds. I even get a little bit of ringing for a split second every so often, but it's when it's becoming more chronic. Maybe it's happening for more than a few minutes at a time, maybe more than a few times a day. For some people, it becomes a constant problem, and so it can become really distracting, really bothersome. It can really cause a pretty negative emotional response.
Yeah, aggravating for sure.
Absolutely. Wow. Are we seeing it in a certain age group or pretty much all across the board?
I'm seeing it in most age groups. I mean, hearing loss is more prevalent as we get over 65, so tinnitus is going to be more common in that population as well. But noise exposure is also a huge factor that's playing into hearing loss these days, and that's hitting every age. Everyone is around noise at some point. Not everyone is really thinking about protecting their hearing enough. So, I mean, I've seen children who have ringing in the ears, but more often I'll see it in young adults and older.
Yeah, those earbuds on full blast. I know that's not good.
Yeah.
So it being Tinnitus Awareness Week, how should people, you know, maybe be a little more cautious, or what should this week spark in your head?
Well, we're always trying to promote just healthy hearing in general. So because hearing loss is one of the most common causes of tinnitus, just getting a baseline hearing test is good regardless of your age or if you're having any trouble. But tinnitus can also be symptoms of other things. It could be symptoms of maybe blood pressure issues or TMJ issues. There's a lot of different things that it can be related to, different medications as well. So if you're starting to experience the tinnitus just kind of out of nowhere, then it might be worth talking to your primary care provider or going to see an audiologist to take a look at your hearing. It's kind of our whole body that we're trying to look at, but yeah, tinnitus is most closely related to our ears.
Perfect. Well, thank you so much for being here. And if you're looking for more information, definitely head over to the Bluegrass Hearing Clinic. Head over to their location and or check them out online so you can make sure that, you know, you are hearing everything properly and can kind of prevent that early. So thank you so much.
Thank you again for having me.
Thank you.